that rap song. Oh my gosh, my son was like dancing to it.
Right. All right. So we're in Unbreaking Science here from Allison Park, Pennsylvania. We'll be bringing in our guest in a little minute here. Today on Unbreaking Science, we're going to be discussing a number of things, including this new finding that the enterovirus is present in the spinal fluids of children with acute flaccid myelitis. We'll be talking about the federal bid for removing personal exemptions and what we need to do about that. And we'll be talking about a training program that's coming up, a training class that's coming up here in Allison Park, hosted by PCIC. My name is Dr. James Lyons-Weiler, the CEO and president of the Institute for Pure and Applied Knowledge, and your host on Unbreaking Science, coming to you live from the WWDNYK studio. So, with all of that on the docket, there's other things that'll come up, I'm sure. We're going to have a very nice conversation today with my guest, Diana Campbell. How are you?
I'm good. Thank you for having me today.
Yeah, thanks for being here.
Sure.
Great. So I got to bring up the web controller here. I'm very informal about this. I'm not like putting on a show. I'm just among friends here putting on a conversation or having a conversation. So I can cut back and forth. A new Vieta, who is the bus driver, vaxxed. He's a real tech head, friend of ours, you know him, and he set this. He helped me set this up.
Did he fly into Pittsburgh to do this?
No, it was all done remotely.
Wow.
It is all done remotely. So he told me what gear to get, what software to get, and trained me on moving back and forth between cameras. I do it from the cell phone. It's really cool. It's a really kind of convenient setup. So you were just over at the location of the event,
Yes.
setting up that's on the 26th.
Yeah,
Right?
that's this Saturday, October 26th.
All right, cool. So we'll get into that in a little bit. But first I wanted to talk about, Pennsylvania level exemption threats and then federal level exemption threats. It's this morning I was writing up my professional opinion about the request for information on their, I guess it's a 2030 call, one of these whole population health calls for non-federal stakeholders, it's called. Everybody needs to weigh in on this. I should cut to myself. See, I'm going to get back in the groove here. Everybody should weigh in on this because the federal register, the request for information from non-federal stakeholders, the deadline for your comments is tomorrow, developing the 2020 National Vaccine Plan. This is perfectly predictable that with the successes that we've had around the country in terms of educating the legislators, that we have a subset of people in the population who are unlikely to ever be able to bring themselves to vaccinate. Out of frustration, they seem to want to, I'm going to cut to that, they seem to want to mandate vaccination without exemptions, as if there was no good reason for the personal exemptions that were there in the states in the first place. And so the Offices of Infectious Disease, HIV/AIDS Policy, Office of the Assistant Secretary of Health, Office of the Secretary, Department of Health and Human Services calls through this notice the development of a national vaccine plan mandated by Congress. And there's a to help inform the National Vaccine Plan 2020, HHS is issuing a request for information. The RFI will solicit specific information regarding the priorities, goals, and objectives in the next iteration of the MVP, remaining gaps in stakeholder perspectives from the 2020-2025 timeline. This is a call to you, non-federal people, to get your perspective, your opinion, your experience into the process for consideration. And now's the time to do it. So whatever you have on your table, everybody's really busy right now, but whatever you have on your table, take some time. You can reuse other things that you've written for other testimony and so on. So they have some specific questions that you may address. I mean, they seek input and strengthening and improving the nation's response to vaccine preventable diseases, what they call vaccine preventable diseases. They should change that to vaccine minimizing diseases, because many of them just minimize the symptoms. They don't actually prevent the disease, but
that's the first I've ever heard that explained, and that's a great way to explain it.
Yeah. Yeah. So if we go to that website, it's the federalregister.gov. We'll post the link in the comments, but let me bring that back up again where we had it. There's every reason for you to take, half an hour of your time, stay up a little bit late, get up a little bit early, whatever it takes to get your voice in there, because the entire population vaccination agenda is supposed to have post-market surveillance studies that catch the rare adverse events through passive collection of vaccine injury, and we know that vaccine injuries are not caught by the VAERS. We know that the doctors don't report them. We know that 1% of vaccine injuries are reported, and doctors are breaking the law. Actually, they're required by law to report each and every adverse health effect, whether that adverse health effect is they consider it due to vaccine or not. They're not supposed to interfere. They short-circuit the scientific process that was established by the National Vaccine Injury, Childhood Vaccine Injury Act of '86 by saying, no, it wasn't due to the vaccine, or just by not reporting. By not reporting, then, we'll never know whether these obscure rare things that are happening to people, or maybe not so rare, like asthma, allergies, rheumatoid arthritis, might be due to it. And so because they assume that it's not due to the vaccine, they don't report it, and therefore it doesn't get into the vaccine database, vaccine injury database like VAERS or the VSD. And because they assume that it's not caused by it, then the conclusion is that it's not caused by it because it's not showing up in the database. So any input on how to improve vaccine injury surveillance would be, we're the only population that's ever going to say that. The pharmaceutical companies are not going to say, yeah, we need more vaccine injury tracking, right? They're going to say that we need less. They're trying to weaken all of the warnings and weaken the vaccine inserts, weaken the vaccine data sheets from CDC. So it's on my Facebook page, but we'll post it again. For this request for information for non-federal stakeholders. My focus on this and what I'm writing about are twofold. I'm basically going to hammer on the fact that non-medical exemptions are an essential safety valve on the whole population vaccination program. Without it, they stand to lose the entire thing, right? And that's the argument. It's in their best interest to have non-medical exemptions, or I call them personal exemptions, because if you don't, then you're going to have people rioting in the streets over the mass vaccine injuries that are going to occur when they add another 10 vaccines to the CDC schedule. If they don't learn, if they don't get ahead of this, they're going to lose the entire game, which might be fine for some people, right? But what I'm doing is I'm upsetting the apple cart a little bit here. So making points like any paradigm of 100% forced vaccine will reveal by injury, maiming, or death from everyone in the population who's susceptible. I'm highlighting that science has not defined any way to identify the individuals in the population who are most susceptible. That susceptibility and vaccine injury to death is almost certainly has a genetic risk that is not universally shared across the population, and therefore universal forced vaccination is discriminatory and places some families at increased risk of carrying all the burden of morbidity and mortality. It's a very real representation of what we're seeing, and it's not fair. So that's the one point, and basically, the denialism is cruel, and then I bring up the counter arguments and say, well, this is why people would say that my comments are wrong. Vaccine studies have been conducted that should have detected the adverse events claimed by citizens who no longer want to vaccinate. No, they haven't. We know that, right? They're basing it on the absence of science. And the second counterclaim is, well, vaccines are such a boon to public health that individuals who are not entitled to a choice are not entitled to a choice or to informed consent. And in reality, I'm citing the Code of Federal Regulations that give us all the right to say no to any vaccine because of post-market surveillance science. We're not to be enrolled in a clinical trial without our consent, and your children are not to be enrolled in a clinical trial without our consent. These are human subject studies. I'll publish these comments on the blog at jameslyonsweiler.com in the citations, and I would encourage people to start looking at these Code of Federal Regulations. We've all been saying, well, we need informed consent because it's a medical procedure. People have been arguing that. But people haven't informed their school board in these states that don't have personal exemptions. They haven't informed their school administrators that where they don't have religious exemptions, that, well, still we have this ace in the hole called the Federal Register, that under the Federal Register, you're not going to participate in enrolling my child in a clinical study. And in fact, the school nurses, the school administrator, the doctors working for the schools denying exemptions, they're participating in breaking federal law by enrolling these students in a human subjects trial by coercion. And the verbiage is very, very specific in the Code of Federal Regulations that there shall be no coercion whatsoever. People have cited the Nuremberg Code, and that's very similar. Our Code of Federal Regulations over human subject trials is in part inspired by that. But basically, I let them know that U.S. citizens are asserting their rights under the U.S. Code of Federal Regulations and will continue to do so, and that no parent that's ever witnessed their child vaccine injured is ever going to vaccinate, regardless of the amount of coercion. And that, therefore, personal exemptions are a safety valve. Not only on the vaccine safety program, there are ways that society enacts our ethos as Americans. There's something in politics called the wisdom of the minority. You might be the winning majority where you take over a country or take over the White House or take over Congress or whatever you're doing. But there's the wisdom of the minority. There's value in being challenged by a minority view because you see things from two sides. And that's a part of our ethos. That's part of our culture. And instead, they're shutting us down, they're censoring us, and so on. And, there's our laws and international laws protecting human beings from harm from human experimentation. I say that loss of personal exemption options may appear to be a trivial change to the majority of Americans, but for some it means certain death and destruction of their lives. And I conclude that for these reasons and realities, it would be both immoral and unethical to remove or deny personal exemptions of vaccination. So, how do your doctors handle personal exemptions? How is it in Pennsylvania?
Well, in Pennsylvania, you do have exemptions, but we are having a issue in Pennsylvania where people are getting these letters where pediatric offices are essentially firing you from their practice if you do not follow the CDC schedule. So even if you miss one vaccine, I do know somebody that completely vaccinated their child on the CDC schedule except for the first year of life, except hepatitis B, because someone had mentioned it to them and they were dismissed from their pediatric office. So I did get a text message just this week, a couple days ago, from someone who was fired from her pediatric office, and she went to a family practice, and UPMC sent, this practice sent her a letter that said that if you have pediatric patients, if you do not follow the CDC schedule, we are now kicking you out of this family practice. So I guess that's happened a couple times. So, because, what we were doing, or, what people were suggesting was just go to a family practice if you have to see a doctor. So it's getting, and, all these big, these big conglomerate healthcare networks are buying up all the small practices as doctors are retiring, or they're buying them out and putting them under their umbrella, and then saying, okay, well, now you got to play by our rules. So you could be, I have someone else that lives close by here. They have been a patient for, their family was a patient for 19 years.
Yeah.
Kicked them out. So it's really a travesty that's happening. But in Pennsylvania, to go to school, you do have your religious and personal exemption.
Wasn't that a boon then if they kick them out that they're going to go find naturopaths, they're going to go find other people that will actually take care of their kids?
Yeah, the only problem with that is that some of these patients do have vaccine injured children.
Yeah.
And for some therapies, you have, and depending on your insurance, you have to have a pediatrician sign off on those therapies. So people are being denied health care for their children because they've seen an injury, and in some cases, it's even documented that they do believe that the vaccine causes injuries.
So let's go into that a little bit detail, because I'd like to know what allopathic medicine does for vaccine injury when they don't really recognize vaccine injury. What kind of treatments are you thinking about?
Well, I guess the like occupational therapies and speech therapies and those different types of therapies. I do not have. These were just
so. So in other words, you're saying that they're vaccine injuries that you recognize as vaccine injuries, and our population, our community would recognize them,
yes,
because they're so prevalent among the vaccine injured ex-vaxxers, right?
Yeah.
But they can't get like a speech pathologist or that kind of thing unless a pediatrician signs off on it. I mean, that seems cruel.
I mean, not for every circumstance, but depending on your situation.
Yeah.
I mean, because we have to remember that too, that all these things are really expensive. I mean, vaccine injury is extremely expensive.
Sure.
And people need to try to utilize their insurance. If unfortunately everyone's sucked, that's a whole other radio show. But I know people that are really, really struggling. And
oh, sure, vaccine injury. Autism means stress in the home. It means additional, not just medical costs, but additional child care services. It means a different schedule. In some cases, it means stress on the relationship in the marriage, where the parents have all this undue stress.
Yeah.
They love their kids. There's no doubt about it. They're going to take care of their child, and that's the government, I think, is ditching so much of the responsibility for the injuries on the families. Certainly abdicating any responsibility in National Vaccine Injury Compensation Program by denying every vaccine injury that they possibly can on the slightest little whim. So
one thing I would encourage people to do is, if you, not just your doctor, even though your doctor is supposed to report to VAERS, if you know of your injury, you can also self-report your injury to VAERS.
Yeah.
And I encourage everyone to go out and do that if you have not done that, because I just took my own little poll in a couple Facebook groups. And just asked if you know that you have had, or your child's had, adverse reactions post vaccination.
Yeah.
Have you reported to VAERS? People didn't know that you could. There's no time limit to reporting to VAERS, and that you can get your medical records, get the lot number, and start reporting that to VAERS, because there are times that first of all, you'll never know, right? Because we're not capturing all those injuries,
right.
So you don't know those connections. My daughter had chronic kidney infections after vaccinations, and I did talk to Dr. Moss about that, because he's a nephrologist, and he doesn't doubt it. I mean, she does have some allergies with some of those ingredients that were in those vaccinations, but that's not something that's typically heard. People don't say, "Oh, my child suffered," but we don't know that.
Right.
So I find it extremely important that this community start utilizing what we were given, because no one's making anything up. That really happens. So that's my little own call to action to everybody out there listening, is to try to make that file to VAERS.
That's great. Let's stay on that for a minute, because a lot of people, I hear a lot of times people think that VAERS and the National Vaccine Injury Compensation Program or Vaccine Court are somehow connected. They're only barely connected. You can have a case in National Vaccine Court without having it ever reported to VAERS, and you don't have to file in Vaccine Court if you report to VAERS. You just file the vaccine injury that has happened. And further, if the number of vaccine injuries that VAERS captures will help determine national policy on vaccination. There's no doubt about it. This is where we are supposed to report these. And you're right, the doctor can do it, but anyone can do it. You can report a vaccine injury of your neighbor if you know all the clinical things. You can do it for them and with them. You can't do anything false. There are penalties for falsifying any vaccine injury and report. But I also was recently alerted to a second option that our community might want to consider, which is reporting your vaccine injury, even if it's, or your child's vaccine injury, even if it's already in VAERS, to the vaccine manufacturers. If you look at the inserts, they say report it to VAERS or the CDC or to the vaccine to the vaccine manufacturer. And we all look at that and we say, yeah, like they're going to do anything about it. But in reality, we don't know that once you report that vaccine injury to the vaccine manufacturer, they have to report it to the FDA, not the CDC. Then on every vaccine injury that's reported to the vaccine manufacturer, the FDA then issues a letter and asks the vaccine manufacturer, was this specific outcome studied in your clinical trial? And if they say no, that initiates an entire new investigation from FDA to look over all the vaccine safety studies submitted by the vaccine manufacturer to see if it was sufficient. So if we swap vaccine manufacturers with vaccine injury reports that are real, you could take your VAERS report, you can download everything from VAERS, you could just put it in a file and send it in with a letter that says, this happened and I want the FDA to be alerted. It's a very informal process, and to pile on your action alert, do your VAERS report and also the manufacturers. So
something that was kicked along on a conference call I was on was possibly at these bigger events that we start setting up some computers to help people start getting that process going. I mean, because then you have everybody in one place and you can start that process. So that's always something that we could, even you and I can talk about. But when we do have large gatherings of people, I mean, let's, every once in a while, even mainstream media will be like, well, there's been this many.
Yeah, it wouldn't take much to collect all of the mailing addresses for all the vaccine manufacturers. So if you're, hurt by a vaccine from GSK or Novartis or Sanofi Pasteur or Merck, if somebody just pulled all the correct addresses together to put from the vaccine inserts and then distributed those, it really doesn't take much to make a complaint about the specific. Everybody knows the clinical situation of their child. They know the date of the vaccination and they know the type of vaccine that did it. So it wouldn't take much at all to get thousands and thousands of reports
I mean,
going
I really
to the FDA chasing after the vaccine manufacturers. It's a way to short circuit the CDC blocking. CDC actively blocks any progress in understanding vaccine injury, but the FDA has no such interest in doing so.
I mean, we should definitely be using what we've been given. So if by finding those, that that's something that we could, let's circle back around to. But hopefully that planted some seeds out there.
Yeah, let's do something like that. I'd be happy to help out. You're listening to Unbreaking Science with Dr. James Lyons-Weiler and my guest Diane Campbell, and you're viewing it. We really don't have just an audio. Everybody sees everything. But I want to take a moment to do a commercial. She just waved. Do it again. Wave again. That was cute. Yeah, I want to do a little commercial here for Unbreaking Science, the Patreon page. If you go to the Unbreaking Science Patreon page, there's various levels by which you can support us with a small monthly. So that we continue to do these kinds of things, and also be more than happy to plug, of course, the Institute for Pure and Applied Knowledge. If you'd rather have your monthly donation go to research, you can click on how to donate. If we have a surprisingly small number of donors that have supported IPAC and with their monthly donations, and they're diehards. They're not giving up, and so every little bit that comes in will be put to good use. Every dollar will go to biomedical research and with our peer-reviewed publications and so on. The other topic I wanted to get into a little bit here was the topic of acute flaccid myelitis and I don't think I put up a website for it, but there's a recent study out that, I have it here on the other computer. There's a recent study that found enterovirus in patients, and this is not the first time that they found it. It looks like back in 2014 they may have suspected it. They found an enterovirus D68 virus in the spinal cord of children and patients, other patients that have the acute flaccid myelitis. Now, acute flaccid myelitis is a polio-like condition, and I've been reading up on it. This EVD68 is the type that they found, and enterovirus D68. There's been a number of people that have asked the question, where is it coming from? It's supposed to be a respiratory virus. It certainly wasn't widespread. We didn't see this when we were children. And there's a couple of ideas about this that we should explore. One, of course, is the hypothesis that perhaps there's a contamination of a widespread vaccine, right? So some of the vaccines that are contaminated with viruses, like we know MMR from Merck is contaminated with the HERV-K virus, and we know that there's the SV40 virus, the cancer-causing viruses and other vaccines. The question is whether or not something like the flu vaccine or maybe the polio virus or other vaccines might have an enterovirus contamination. And I've put a little bit of time into it. If anybody wants to go dig through biomedical literature and dig through the internet to try to see if there's any evidence of anyone detecting enterovirus D68 in a vaccine, that would be critically important to know. And help us set the record straight. And if you do find that, please, by all means, email, contact me on Facebook. The other idea is that there's two more ideas. The other idea is that the flu vaccinations that people get just before they go to school, and I probably will bring this website up because I want to show the seasonality of it. So let me just add this. But the flu vaccination, I got to go to a browser on this. The flu vaccination itself occurs seasonally, and other vaccinations occur seasonally, right? So parents that are taking their kids to school will catch up at the end of the summer, and that's where you get 3-4 vaccines at a time, which is a problem. We know it's a problem due to Neil Miller's analysis of the VAERS data, but they also get the flu vaccine seasonally, and so the idea is, there could be a problem potentially that's caused by getting multiple vaccines and somehow getting some autoimmunity. But more specifically, I'll bring this image up to show the seasonality. But more specifically, there could be a problem with a specific vaccine causing, with aluminum adjuvant, causing a problem in children who have been vaccinated. Sorry, I'm not browsing. That's wrong. I'm trying to add a web browser. Here it is. Okay. Children who have been actually vaccinated with aluminum-containing vaccines might have an enterovirus infection. And if they have aluminum in their system while they have an enterovirus infection, that can get out of hand. So here it is. I brought it in. And if we scroll down now, there's Michelle Cotterman. There's Ted's opinion. And let's see if I can get this to the... Here we are. That's the seasonality. There's a mysterious paralysis affecting vaccines. This is in IPACmedicalhealthnews.com. This was a previous manifestation of the publication. We now have a peer-reviewed journal called Science, Public Health Policy, and the Law. These articles are probably going to be ported over, but I have to submit them to peer review first. But if you're looking at the mysterious paralysis affecting children, what we're looking at here from the CDC is the cases of acute flaccid myelitis, and I'm sorry you can't really see it, Diane, but this seasonality. So every year there's these cases of acute flaccid myelitis that happen about the time of June to August, October, and the idea is that there may be some autoimmunity caused by people hypersensitizing their immune system while at the same time the kids get an enterovirus infection. So either various hypotheses are vaccine contamination with enterovirus, or autoimmunity from vaccination. And what we really need to do is test the hypothesis with science. We need to go to the vaccines, test all the vaccines for any evidence of enterovirus contamination. And that's a study that we could actually fund. Well, IPAC could do that study with public funds. We could acquire the vaccines. We could send the samples out. We could get them tested with RT-PCR, the same RT-PCR, PCR. I don't know if our enterovirus is an RNA virus or a DNA virus. Doesn't matter. We can get it tested with PCR and see and screen vaccines. It'd be a lot less expensive and more time efficient if everybody searched the internet for contamination of vaccines with enterovirus. There's a couple of articles out there where people have proposed this. It's not a new idea. There's a couple of people who have sent me information about it. And I've read those articles, and so there's bacteria that might be causing that are known to be I guess there's nanobacteria that are known to contaminate vaccines that might be associated somehow with enterovirus-like symptoms, and so it's not a clear-cut situation, but it's deadly. AFM is deadly. The one thing that I did want to note is that even the mainstream medical researchers that are looking at AFM are profoundly puzzled why kids who don't vaccinate never get AFM. So if you're not vaccinating, you're not getting AFM, but that doesn't tell us between those two hypotheses that is a vaccine contaminant or it's hyperstimulation of the immune system while you have an infection, which I call the two-hit hypothesis. So anyone that has any information on that, if you look into it and you want to send me that information, we'll post it on the Unbreaking Science Facebook page and our other Facebook pages. But I don't know anybody personally in Pennsylvania that has this. Do you?
No, but they did report on that last fall, I think, that there were a couple cases in Pittsburgh.
Yeah.
I do know that there are actually groups specifically for that.
Mm-hmm.
So I don't know if you're honed into those groups at all, but that's something that maybe you could look into.
Yeah, it's kind of a smoking gun now that they found the virus in the spinal cord. It's reproducing in the spinal cord of kids and adults that have AFM. It's no longer a mystery, they say. We know that it's the enterovirus. Now the question is the enterovirus just picked up like a respiratory infection and the vaccines are setting off a firestorm because they, stimulate the immune system with the two-hit hypothesis. And Eli Kaplan actually published that in the IPAC Medical News. And like I said, we'll try to port that over to the other journal. But or is it a contamination? If it's a contamination, there's going to be hell to pay. Because if there is a contamination, then regardless of, it's a product flaw, we can't sue for product flaw, becomes a vaccine injury, right? But here's where we get them. They don't have to test vaccines for safety of aluminum or mercury, but they have to test for the safety of the proteins that are included there, right? So the adventitious viruses and contaminants, I'm not sure that they're responsible for that. They're like, okay, well, this is why the Supreme Court minority view was published that vaccines are unavoidably unsafe, which is a cop-out. That's like saying, well, I can't help speed. You get pulled over for speeding. Well, I just can't help it. I just like doing it. It's unavoidable. No, you want to speed, and you're doing it, right? You don't want you don't want to stop speeding, and so you're cruising down the highway, and you just say to the police officer, "It's unavoidable." Just like vaccines are unavoidably unsafe. I love to hammer down, That's an excuse. That's a cop out. We've got people that are in pain and suffering. So I can't say I'm on top of the enterovirus situation as much as I'd like to. I did review and edit that one article that we published, but what I'd like to do is find a team or define a team that's going to get focused on testing vaccines for enterovirus. It's a Hail Mary. If we rule it out, fine, it wasn't that. It still doesn't exonerate vaccines as a potential cause by stimulating the immune system. But if we can nail that there's a contamination of enterovirus, I mean, we're doing the government's work at that point. Then we can put a call to better screening of the product. And remember, vaccines are a pharmaceutical product without a doubt. Okay, so the other thing I wanted to mention is just received a package. Whoever sent it in, thank you very, very much. I just received a package of Halloween.
I have something.
Yeah, you do?
Yes.
Okay, cool. Diane brought something. You don't have to get it right now.
I'm not.
Somebody just sent in a package of Halloween decorations for Danny. Danny is the son of a friend of ours he's an adult, a brother of a friend of ours, who's an adult special needs kid who loves the Wiggles, and he loves any kind of sports and that kind of thing, but somebody apparently decided to steal all of his Halloween decorations. And so, and he also complains correctly that, he's kind of isolated, doesn't get any letters. And so, if you have a big heart, you'd like to make a friend and a pen pal, I'm sure Danny would like to meet some of these fine people in our community, the best people in the world. I don't mean that in a superior way, like Superman. I mean that in the biggest hearted people, the kindest people that I know anyway. So I'm going to just go slowly now. I'm going to give you my mailing address. If you want to send a letter or get some Wiggles merchandise or any sports merchandise, a hat or whatever, we ordered 3 Wiggles t-shirts. He's 2X on clothing. Grace and I sent him 3 Wiggles, 2 yellow and 1 orange, I think. So he's got that coming. But if you guys wanted to send anything to me, I don't want to give out his address, because if something happened to him by me, advertising his address, we live in that kind of age. But the address to send a letter addressed to Danny, care of Dr. James Lyons Weiler, at 2912 Kilcairn Lane, Kilcairn, Allison Park, Pennsylvania, 15101. Get something to write with. I'll say it again. Send it to Danny, care of me, Dr. James Lyons Weiler, at 2912 Kilcairn Lane, Kilcairn, Allison Park, PA, 15101. I'll make sure that gets sent out. We have a deadline on this. If you can send it by October 27th, which is 5 days or so, 4 days from now. We've still got 4 days. So you can go to Amazon. I hate to send people there, but you can go anywhere, and you can just do it and send what you want to send to Danny, and send him a note. He'll get your return address, and he might be able to write back if somebody helps him write back to you. So I just wanted to be sure to throw that in there. Let's talk about PCIC. I'm going to bring up you first, and boom, there you are. So PCIC is the Pennsylvania Coalition for Informed Consent. You're a statewide organization. Mm-hmm. And you what kind of organization is PCIC?
So it started off as a grassroots organization, and their purpose, MO, is to preserve the informed consent when it comes to vaccinations and other medical procedures in Pennsylvania. So that's what that organization does, and you can sign up for emails at www.informedconsentpa.org.
I have the website up on right
now. And this Saturday, October 26th, PCIC is supporting us, but the event is actually sponsored by Pittsburgh area and Nutri-Pharmacy. So it's being held at Nutri-Pharmacy in Allison Park, and it is an intense advocate training course taught by Miss Ashley Dobbs from Illinois. She runs Illinois Freedom Keepers, and she's developed a really incredible program. I'm very, very excited, and she has been teaching it in
So what are the kinds of things that she's going to train people on?
So we're going to go over a few different things, but we're going to talk about different legislative advocacy, so there's a personal social media aspect to it in a community. And we're going to talk about different strategies and tactics in order to reach SMART goals, because many times when action alerts go out, like federal action alerts, or, each of your state has a state group that is, at this point, almost every state has somebody that's sending out action alerts, when different legislation hits. I get flooded with messages, and I know I'm not the only one. What do I do?
Yeah.
Because people are afraid to talk to their legislators. They don't understand. So we're going to talk about how to build a healthy relationship with your legislator, not just going in one time and saying, vaccines are bad. We want to develop this healthy relationship.
Yeah.
So, and it's crucial and important. And then also, how to honestly write an effective letter, how to maintain that relationship. We need to understand that if we're spending all of this time creating a relationship, that we also need to support them, because if they lose, if we find legislators that are willing to defend medical freedom, we cannot lose them, or you're starting over. And God only knows who they would be replaced with. And also too, if there's a legislator in your area, Pan, that you want to get out of office, how to back their opponent and get it done. And Oklahoma's activists have been extremely successful in doing that in Oklahoma. So that's something that, paying attention to what other states are doing. You might not be in the same climate as them, but everybody's kind of, everyone kind of got thrown into this, and now all states are really starting to get organized, and it's, we're starting to make some leeway. This is a shifting point. I mean, I feel a shift. So, and then also we're going to go over actually choosing an advocate group that aligns with you, right? There's lots of different advocate groups. And I do suggest that everybody follow your state groups, but and pay attention to what they're doing and support them, because you've been traveling the country. These are the hardest working people I have ever seen in my life. They're putting a lot of hours in. They're essentially working for nothing. And if you see them out, if you know something's going on, please do something nice for them, like get them a cup of coffee, or when Washington State and California have been fighting this year, and Maine, those people just worked around the clock. They never stopped.
There's the exhaustion that sets in. There's no doubt about it. Magnesium deficiency, exhaustion. There's the stress. There's the you're not only handling being the face of the community in your state, but you're also then sometimes challenged with infighting in your group and differences of opinion. And we weren't born knowing how to interact in this very unusual way, right? It's we're not an easily identifiable community, and so we know people on the basis of what they tell us about themselves, as opposed to we're not Native Americans, where there's that instant recognition where we're a defeated people, and the white man did this to us, and they took our land, and they took there is this mistrust that's inherent to this. And I talk about this a little bit in terms of there's a video I put out on legislative flu, right? So it'll be interesting to see what Ashley has to say about this, because one of the ways that they control opposition, people think control opposition is voluntary, like I signed up to be a controlled opposition. It's not. The most effective controlled opposition is somebody who's controlled opposition and they don't know it. That's dangerous, right? If there's a Merck plant out here in our community, and if there's an FBI plant within our community, and the problem is we don't know who they are, right? It's like, the Black Panthers were infiltrated, and how they took the Black Panthers down is their MO for controlled opposition. But there's also the PSYOPs end of it, where a legislator will say, well, I'll talk with you, but not this other person in your group because they offended my colleagues. And they're going to turn off my colleagues to your message. And if I'm going to push your message, they can't meet with people. What a brilliant way to shut down somebody in your group who's really effective, and they don't want them to show up because they're much more effective a communicator than you are, right? Let's put a face on this level of control. This like type 2 controlled opposition. And there's definitely a healthy message about strategy with respect to advocating tactics, where okay, if you're going to talk with this legislator, take this approach because they've been responsive to it. If you're going to talk with that legislator, take this approach. There's not one universal approach. No. Let's agree to that. But there's also the idea that, okay, well, if I've built this, I spent my time building this relationship with this one legislator, and I don't want anybody to upset them because, just the wrong words will send them away from us, and it'll destroy all of this, right? And that's a good message to look out for. We got to be careful. You don't undo the good that's been done in terms of building relationships. But then there's also the time, the sign of legislative flu is when a legislator says to you, well, I'll work with your group, or I'll work with you or this other person in your group, but I can't work with this person, or I can't work with that other group because they're going to alienate my colleagues. What they're really doing is they're saying, I want you in my office. I'll sit and talk with you for 3 hours, but nobody's going to talk to anybody but me. When that happens, that legislator has been given marching orders from the party bosses on the 10th floor, right? That you're the front. You're going to deal with these anti-vaxxers, and don't let them get into the other offices. No, I don't care how you do it, but don't let them take up the time in the other legislators' offices. And so some of the tactics that I've seen lobbyists, and I'm no lobbyist, I'm just an educator, and I say so when I go to legislation. When I go to the capitals, I say I can't tell you whether I'm for or against anything, but I can tell you what I know. Some of them include going into legislators' offices not as a group, but scheduling meetings on different days, and then not identifying that you're with a particular group. Oh, I'm just a concerned mom. I'm just a concerned dad. Because then we get more and more and more time in their office, as opposed to, I just spent 4 hours with your group. I don't want to talk to you. I'm busy. I have other things I'm working on. And they screen, right? So they'll come out and they say, are you in the same group? And if you say yes, they say, oh, we've just spent 3 hours with them. We're good. But if you say, no, I'm just a concerned mom or dad, then you'll get more time in the office. So is that the kind of tactic and trick that Nash is going to talk about?
It's possible. That actually is something that I personally do. I go in as, Diana Campbell.
Yeah.
And I will talk about how there are advocate groups that have numbers. I can only speak for myself, but I'm part of a group that has numbers. But today, I'm here to talk to you as a parent.
Yeah.
So I think that that's a really smart, personally. But yeah, she's going to be open for questions and answers. Or, we're going to have Q&A. But also, and you're right, you do want to talk to, depending on the party, there's a different approach to talking to, each of the party and each person individually. And this isn't even just for legislators. First of all, it's very important to get in front of your legislators, because we can fill a room for a showing, and it's extremely important. But if your legislators do not realize that is important to 100 people that are in his district, it doesn't matter.
Yeah.
There cannot be one person going and speaking for everybody. They have to understand that they have a huge pool of voters in their district that this is important to, because they are not going to go to bat for you if they think it's going to cost them votes or their seat. They're not going to.
Naturally, why would they help you if they think that you're a crazy nut minority?
Yeah.
Which we're not, by the way.
But this type of course would also help you with, I have met people in this movement, and I'm sure you have, that have had to sue their school districts because their children were not getting the proper the things that were legally
required.
Yeah.
In terms of notification, you mean?
What was it like? If you have IEPs, anybody that has IEPs for their children have had to advocate for their kids to get their kids what they're legally entitled to.
You shouldn't have to work that hard.
No, but you do. And this is the type of skill that really, we are under attack. If you're paying attention to what's going on, we're under attack. Not just, I do believe medical freedom is probably the most important, way that we're under attack, but we're under attack many ways when it comes to medical freedom.
Yeah.
And so we really have to be our own advocates, because no one else is going to do that for you, right? There's no one's giving us a government grant to fight the government.
Right. So where do people sign up for this training program? And by the way, I wanted to say, if you didn't know, I know you knew, Diane, of course, but I'll be giving a presentation. I don't know if I'm going first or after the training.
Yeah, session. We're going to talk about that today.
Yeah. So you mean during the show or just afterwards?
Afterwards.
Okay. So I'll be giving a presentation on some of the science that I've been involved in. I'm definitely not going to give advice on how to lobby, because I don't lobby. I don't have the experience. I don't have the chops for it. But I'm going to go and give a presentation on the current status of vaccine safety science, and I'm going to talk about the aluminum studies that we've done, comparing the vaccine safety plan and comparing the CDC with respect to aluminum toxicity, how many days children are in aluminum toxicity on the CDC plan versus the vaccine safety plan. But where do the people register for it?
They can register through Eventbrite. We have a few seats left for that. There's a cost to that. But if anybody wants to come in and that is a factor, we have scholarships available. I feel very strongly that the content is extremely important. So we don't want anybody to miss out for financial reasons.
You're bringing Ashley in on your own dime. And so
yes.
This is cost recovery for you.
It is. Right? I do feel, I feel so strongly and so good about this, that this was something that, I talked to my husband about it, and I said, listen, he has some faith in me. So, yes, I've put everything out on my own, just really trying to get the costs covered. And that's where we're,
go ahead.
That's where we're at. So, I'm willing to cover your seat if you want to come in. And we can put the link up later. Is that my special guest?
They're here, so I'll take over for a minute.
Okay, let me go.
Okay, so we have a special guest coming in. Well, that's fantastic. And the event itself is going to be held at Nutra Pharmacy, which is on Wildwood Road in Allison Park. It's about 5 minutes away from my house. Nutra Pharmacy, it's held in the basement. They have some space there. And I wanted to also say, if you have some folding chairs that you can bring, that will help out, to bring a folding chair or two for yourself and a friend. That'll help out a lot. The Nutra Pharmacy is they have supplements, so you can visit there and you can check out the supplements that they have available to you. So let's look here at the Unbreaking Science Patreon page again. I'm going to give a plug while Diane is picking up her special guest here. If you can do a $2 donation for Unbreaking Science, it'll help us with the cost of doing the podcast and running the WWDNYK studios. If you could do a $10 or $20 donation, so much the better. And if you have a rich uncle that has left from Nigeria, that's left you money that you're going to go after, by all means, share in the wealth. And if you want to fund science instead, publicly funded science through IPAC, the Institute for Pure and Applied Knowledge, 100% of our efforts and initiatives there, our projects are funded by the public. None of it's funded by the pharmaceutical companies. None of it's funded by the U.S. government. We're a registered not-for-profit in the Commonwealth of Pennsylvania. We're in phase 2 of applying for the 501c3 status. So unfortunately, as of right now, your donation is not technically tax deductible. But if we achieve 501c3 status, fingers crossed, then we'll alert you to the total that you've donated. The best way to donate is through How to Donate here, and then you can do a one-time donation, or better yet, do an IPAC Monthly Science Hero donation by clicking right here on the IPAC Monthly Science Hero donation. So we are coming back with Diane, and I told them that they're at Wildwood, the Nutra Pharmacy,
Okay.
and I also suggested that if they wanted to, they could bring some folding chairs for themselves and a friend. Or do you have that covered?
We have, we have, we have all that covered, and we have a great, generous donor that is picking lunch out for everybody.
Oh, cool.
So we will be having lunch, and there'll be some gluten-free options, and so that is going to cover, this training course with this. The information is just invaluable.
Yeah.
And a talk by you.
Ashley's great, by the way. You've told me multiple times that she loves me. Well, I love her. She's fantastic. She's so bubbly and friendly and smart and dedicated, and she's got some really good ideas that she shares.
She really does, and I just she also is the creator of the ChristopherBunch.org website.
ChristopherBunch.org.
Yes, Christopher. He is this beautiful boy who last August of 2018 passed away post Gardasil, and his mother or his parents just really want the world to. They don't want everyone to know him as this beautiful boy who lost his life early as a result of a Gardasil injury. They want the world to know what a beautiful person he was. They want to celebrate his life. So she is working with his mother and created this website. So if you want to check out Christopher Bunch.
Let's cut to it right there.
Okay.
Christopher Eugene Bunch. I remember hearing about this. This is a Gardasil death.
I know we did.
I should have the parents on the show at some time.
Yeah, and that'd be a great idea. And he also, we wrote something up for him when Allegheny County tried to come forward. We have a special guest today. Do you want to say hi? They're my ears. Can you go and watch that?
Is that Spider-Man? Are you Spider-Man?
He is. He only gets the phone on very special occasions when we really want him to be good and quiet.
We're close to wrapping up here. Is there anything more about the event that you wanted to mention?
No, I'm just very excited about it, and she's only been doing it from her. She has been traveling very far from her home to do it, so she's flying in from outside of Chicago.
Yeah.
But there are other states now picking her up. When I immediately jumped on this and was like, when can I get you to Pittsburgh? And so I feel very honored that I was able to scoop her up right away before she starts to get really busy because, and this is just something that, I'm really looking forward to. I think that it's going to, we'll wait to see what everybody thinks afterwards, but I have faith in it.
Well, I have faith in it as well. She's intelligent, experienced, and coming at it from with a good heart, and that's what it takes. And so, how many people do you have signed up right now?
There's going to be 25 people there. So we did actually open it up to 40 people, but I'm going to go through there tonight and actually, it's going to have to be shut off at 30 because the room's just not big enough.
Right.
So there's about 5 more seats available.
Cool.
So I'm going to go in there and edit that today. But yeah, that's 25 people that, are going to utilize
really
this.
That's really good. Thing.
So I'm, looking forward to lots of fun. I have a lot of fun things going on for Pittsburgh. I have some big plans. So you and I had talked one time about how I just really, really want to run a big public awareness campaign. And so I am moving forward with that. And
yeah, definitely. Your camera's actually kind of on the fritz right now. I'm going to have to adjust it just a minute. Not sure what happened to it, but yeah, it looks like we're a one camera show at this point. So, but anyway, so we also have VAX 2 coming. VAX 2 is coming. So let's talk about that. What are the dates of that?
Yeah, so the world premiere is I'm sorry, November 6th.
Yeah.
And I'm really glad you brought that up, even though I'm staring at your sweatshirt that says Vax 2.
Vax 2,
But,
there it is.
so anybody who is not, has not purchased a ticket, the way that they're going, doing this is that we are needing theaters to tip. And what that means is that theaters across the country for the November 6th showings have to sell a certain amount of tickets, or else that showing will not happen.
Yeah.
So in the next, today, tomorrow, and Friday, it was all different. There are some theaters that are pretty close to making that. And some of these areas are a little smaller, so they need a little bit of help tipping that. So if anyone can be an angel donor, we can get that up to you. And we could go back and put that in comments or later. But so we want, go ahead.
So the bus is coming.
Yes, so back to Pittsburgh.
Right.
Pittsburgh will not be held on November 6th. It will be held on November 18th because they are bringing the Vax bus back to Pittsburgh. So Pittsburgh's premiere will be November 18th, and the Vax bus will be back, and Paulie Tommy will be back. And I keep hearing rumors that there's other people on the bus, and I won't say who they are because no one will confirm it with me. But we're hoping that there's some other special guests on the bus. So that will be really, that'll be great. And Pittsburgh has tipped, so it will definitely be showing. Locations to all of these theaters are secret until 24 hours before the event,
Right.
because of the current climate that we're in.
Right.
We don't want the theaters to be harassed. So that's what's happening with that.
Okay, so for them to register for the training program, it's at the Eventbrite link. There's 5 more spots, and then for people to register to get their tickets for Vax 2 in Pittsburgh, November 18th. Where do they go?
You can go to vax2.com.
Okay.
And go up in the right-hand corner. There's 3 bars. You can hit tickets. You put in your zip code.
Okay.
There are direct links to that, but they're really complicated links, so I can't.
No, that's fine. Go to
memorize them.
vax2.com. That's VAXXED with 2 I's, right?
Yes.
VII, vaxii.com, and not Vax2.
No, actually, I do think it's vax2.com.
Okay. Vax2.
With the number 2.
Let's see. I'll just bring it up here quickly. Vax2.com. And there it is. Vax2 with a 2. Okay, vax2.com. And you put in you can sign up for emails there, and you put in your zip code, and you can register, and you're good to go.
I just want to plug, there are showings in Philadelphia, which if anyone is near Philadelphia or the New Jersey line, they're having some trouble tipping their theater.
Well, I'm going to be there. I'm going to be on the panel there.
Oh, that's great.
I'll be appearing and giving comment on whatever questions the crowd has. And their date is
all the other dates in Pennsylvania are the November 6th.
November 6th, okay.
And also, you can follow Pennsylvania Coalition for Informed Consent on Facebook and sign up for emails for all the Pennsylvania showing updates, like if something were to happen, or so that's another reason to sign up for the email. So.
Well, I'm really glad that you and Max could come to the studio
Thanks
and
for
talk about all this.
us
All right, you're doing good
today.
stuff. I wish everybody could see the beautiful smile you have right now.
Thank you.
But I've got to get that camera looked at. Apparently, we may be in need of a new camera, so I'm going to plug Patreon donations one last time. I don't know what happened there. But we're very informal here. Diane Campbell, I want to thank you so much for being here.
Thank you for having me today.
Make sure that you go to pcic.org.
No,
PA informed.
PA informedconsentpa.org.
Informedconsentpa.org. I'll cut to that one last time here, and then we'll play over on our way out the sound bug from Naomi, Unbreaking Science. Thank you, Dr. James Lyons-Weiler. Signing out. Hope this works. Let's see if it works. All right. Signing out.
Hi, everyone. I'm your host. host, Dr. James Lyons Myler, aka Dr. Jack. In this episode, we're going to review the evidence that science is broken. This is not a true story.
Will be told, people will know the price of corporate science really taking its toll. Whistleblowers blow, but counts that are low. They say the science is settled, but how do they know?
Science.
Ask questions quickly, think you should try it. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
You can't deny it, you sure can't buy it. Fact check, use your brain, don't be quiet. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
Using the tools of the trade to back up what we say. You can't be silent when it comes to unbreaking science. Let's light the truth up, next level ultraviolet. You got a hypothesis, do a critical test. Make an observation without being biased. Use logic and reason mixed with evidence. Look for patterns and results with significance. Calculate them numbers, real accurate, or else your findings won't be legit. Don't cherry pick, but be skeptic, cause broken science, it makes us sick. That science is being funded by the very same people that run it, so they can promote a product, so they can make that money. Try not to laugh, cause this ain't nothing funny. All these science-like activities, no joke, they call them studies. Hand-picking sample groups and no true placebos. Losing public trust the more and more that we know. The truth will be told, the people will know the price of corporate science really taking its toll. Whistleblowers blow, public health that are low. They say the science is settled, but how do they know?
Science.
Ask questions quickly, think you should try it. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
You can't deny it, you sure can't buy it. Fact check, use your brain, don't be quiet. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.